the dental revenue webinar, turning opportunity into new patients, featuring Larry Guzzardo. My name is Bill Mulcahy, and I am the Vice President here at Dental Revenue. If you're a client of ours, you probably have spoken with me quite a few times. If you're not, you might have spoken to me before, but we certainly welcome everyone that has decided to be on the call. I'm going to go through a couple introduction slides before we turn it over to Larry. The reason I'm going to do this is simply because this webinar is meant to be in conjunction with the marketing program that you all are participating in. And phone skills and lead follow-up is an extremely important part of the overall goal and strategy. So without further ado, we're going to get started. All right. All right, all right, so most of you probably know us by now, but Dental Revenue is a dental marketing company. We've been around for 9 years. We're based in Baltimore, Maryland, and we specialize in marketing for non-insurance based practices around the country. We have about 150, we work with about 150 dentists worldwide, and our retention rate is over 95%. Everything that we do as a program is around what we call the stages of online achievement. And that is the big reason why we are having this call today. If we want to drive new patients and revenue to our practice, 3 things need to happen. People need to be able to find you through searches. They need to evaluate you and choose you over other dentists. And then once the phone calls and leads come into the practice, you need to be able to convert that opportunity into new patients and revenue. The program that we put in place is called the Performance Program, and it's broken into the 3 areas that will help us move potential patients along these stages. The first is the core marketing platform, which handles your optimization and driving traffic to your website. The second is the web platform, which gets into differentiation, your ability to separate yourself from other dentists. And then the third is Conversion Coach. And the Conversion Coach is simply about our ability to answer the phone and follow up on leads. A successful practice converts between 30 to 50% of the incoming calls and leads that come in. The reason they're able to do this is because, number 1, they're answering the phone effectively, and number 2, they're treating each lead as a potential new patient and sales opportunity. So we've invited Larry Guzzardo here today to discuss some best practices around both of these concepts. Larry is a highly respected practice management consultant and the co-founder of the All-Star Dental Academy. And he works quite extensively with several of our current clients. He's a real difference maker in this industry, and we're very lucky that he's agreed to talk with us today. I've known Larry for almost 9 years, and we've been very lucky to have him as a resource and as a friend. And trust me, guys, if you adopt these concepts, your overall team and your approach will be more successful. So Larry, I'd like to introduce you and turn things over. And again, we'll save some questions for the end. So please put your phones on mute until the end if possible. So hold on 1 second. All right, Larry, you should be able to have it now.
Okay, so it looks like we're all ready to go. You can see my screen, Bill? I'm going to
Yes.
take that as a yes. So I want to say hi to everybody. I'm Larry Guzzardo. I got to tell you how excited I am to be here and to be able to spend this time with you this afternoon, because I can't think of anything more frustrating than to go through all the time, energy, effort, and even expense to have your patients call your practice and not have them schedule an appointment. Matter of fact, I don't think there's anything that could be more frustrating than that at all. And so I find that there are some really good practices that people are following in offices just like yours that really helps them convert a lot of these phone calls into new patient appointments. I'm of the opinion that I'm willing to talk to anybody who's willing to talk to me. I've also developed a mindset that I believe people do want to talk to me, or they do want to talk to you when they call your practice. They want to schedule an appointment. It's just that sometimes, even though we don't mean to, we might turn off the patient, or we might not answer their questions properly, or we might not do a good job of conveying who we are or what we do. So they just say, hey, thanks, you've been real nice. And then they go on to the next name that's on their computer search for dentists that they're looking for. So I want to talk about how we can avoid having that happen to us. And I want to do it by not recreating the wheel. What we're going to do here is take some of the best practices that we have seen and that I've been teaching for years in other offices, and I've seen the successes that they've had. I want to make this simple for you. I want it to be simple because I want you to be able to make it your own, because I want your personality and I want your style to come through. You see, I don't want you to feel like you've got to be somebody special or somebody different to be able to talk to somebody who calls on the phone, because you don't have to be. I know that if I ask you to memorize a script or try to be some kind of an actor or actress or something, then gosh, you guys already know you're not going to come across as being very authentic or very genuine or very, very sincere. I know every single one of us has called a customer service department at some point in our life, and we knew right from the beginning when we got that call that we were talking to the wrong person. So we have to understand that being able to convert phone calls into new patients, that we've got to develop a type of customer service personality. And the way that we do that is actually through our tone of voice. You see, the reason why we do it through our tone of voice is because people can't see us. It's pretty simple. They can't see our facial expressions. They can't experience our body language. You see, I'm talking to you right now. You can look at your screen. You can see the slide that I have up here. Now, some of you know who I am, but many of you who are out there don't know who I am. And so I am praying that my tone of voice is conveying to you a very positive attitude. You know, that I'm really excited to be here, that I'm glad that you're on this webinar with us, and that I want to share with you all the things that I have seen and know to work, and want to share them with you because all I have is my tone of voice. And I want you to realize that your tone of voice plays a very, very important role in converting these calls. Part of the reason why your tone of voice plays such an important role is because we know that when people are making decisions, emotion has a lot to do with it. We'd like to think that all of it's done logically, and it's all done because everything makes perfect sense to everybody. But in reality, we know that it does have to make sense. But we also know that how you say something is probably going to be more important than what you say. So that's why I'm not so worried about what you will say. Now, I have some outlines for you, and I do have some phrases that I'll be sharing with you during the webinar to help kickstart things. But I don't want you to think that you've got to learn how to persuade people or how to manipulate them or how you have to talk them into something, because we want people to feel good about the decision that they're making. And we want them to feel excited about meeting you, getting to see the office. You see, you and I all know that when a patient feels that way, they keep that appointment. They fill out your paperwork. They answer your phone calls. When they're not so excited about going to your office or what they're going to find when they get there, then they lose interest very, very quickly. And you all know as well as I do that there's a lot of competition out there today. And so it's very easy for them to click the next name on their search. So I want you to understand, as you're putting your customer service personality together, there is emotion that plays into this. And there's some logic that plays into this as well. We also have to remember that effective communication requires a mixture of both, combined with preparation. We can't just wing it when these folks are calling us on the phone because they'll throw us off. Now, I'm going to talk to you about where we get trapped and the way they throw us off and the questions they ask us when they call on the phone. You see, we don't want to get into any trouble. So you create a customer service personality. Another reason why your tone is so important is because it's through your tone of voice that you actually project your attitude. I think that every one of you would agree with that. You see, your attitude is what appeals to their emotion. If a patient gets the idea that you've got a positive attitude, then they're going to want to learn more and pay attention to what you have to say. So what I want you to see is that attitude equals listening. If you want people to listen to you, use the right tone of voice. Of course, this isn't a speech course, but all of us know we don't like people who talk really, really low. And by the same token, we don't like people who talk really, really high. You know, we like people who have a rather level tone of voice. We don't like people who talk really loud inside the phone. You know, all of us have been sitting in a small room with somebody who's talking on their cell phone, right? And we wish they would just be quiet. And by the same token, we don't like to have to struggle to hear what somebody's saying because they're speaking so softly. We like somebody who has a casual manner in their tone of voice. We like somebody who has a level tone to their voice. We don't like it when people raise their voice at the end of the sentence. You know, well, how is it that I can help you? You know, where it almost sounds like a question. It makes you sound very, very youthful and not nearly as professional as you probably are. We like people who just have a nice level tone. The important thing for you to get is that it's through your tone of voice that you project your attitude. And when patients realize that you've got a positive attitude and that you're excited about what you're saying, and then they're going to listen to you. As I said earlier, all of us have called the customer service department, and we knew within the first few seconds of that phone call whether we thought we got the right person or not. Matter of fact, studies have told us that when we meet people physically, it usually takes us about, we're real generous, about 40 seconds before we decide whether we think this person is wealthy, whether we think they're smart, whether we think they drive a nice car. My point is that within a very, very short period of time, physically, we're going to size up this person and we're going to make some assumption about them. I know we're not supposed to do that, but we do. Now, those same studies tell us that when we hear people over the phone, just like through their tone of voice, we develop that opinion about each other within about 6 seconds. So what I want you to hear is that people are sizing you up before you've barely even said hello. That's how important tone is. So we have to make sure that we use it to our best advantage. Now, the words that you speak, that's the technique that you use, because the technique is what appeals to logic. I said earlier that what you say has to make sense as well as sound good. It just can't sound good. So it's the logic within your technique that promotes understanding. If you want people to listen to you, control your tone of voice, because if it projects a positive attitude, because you want it to project a positive attitude, if you want them to understand you, then choose your words carefully and say your words in a certain order that makes sense to them. So good customer service personality puts the technique and attitude in action. I want you to see as we go through this webinar how it all works together. Now, You would think I wouldn't have to bring this up because all of you are talking to patients over the telephone. I feel like it's very, very important. I'm sorry. You would think I wouldn't have to bring this up, but because all of you are talking to patients over the telephone, I feel like it's a very, very important part of it because unfortunately, we could lose many, many of those calls just because we didn't pick up the phone correctly. So it does have a negative effect on us when it's not done correctly. And I'm going to give you 5 steps that I want you to be able to follow. The first step is just indicating to the patient, we're really glad that you called. Part of the way that you're able to do this is by using an appropriate greeting. What I mean by that is when you answer the phone, you want to take a deep breath. Maybe put a smile on your face because that good body language is going to come out in your tone of voice. So you want to answer the phone and you don't want to sound hurried. If it's slow, if it's short, that's the right kind of greeting. To me, it sounds something like, "Thank you for calling Dr. Jones' office. This is Larry." Now, I prefer a very, very short greeting. I find in many of these calls that I've audited over the years that we get cut off because our greeting is too long. So I like it simple. "Thanks for calling. This is Larry." Short and brief. And mention the doctor's name and all that. I don't feel like you have to say good morning or good afternoon. I mean, if you're like me, you kind of forget what time of the day it is and you give the wrong time. I think if you just say, "Thanks for calling our office," that's okay. Now, I know there's lots of other ways that you can do this. I'm just going to express to you that I feel the best way is if it's short and in a nice tone of voice. "Thanks for calling Dr. Jones' office. This is Larry." When it's appropriate and it's short like that, the greeting is also friendly because you can use other people that you have called as an example. When the greeting starts getting too long, it gets monotonous for you to say. You know, "Thanks for calling our dental office. How can I give you the most perfect service today?" and give you a smile that's wonderful. It's like they're worn out and they're out of breath by the time they've answered the phone. You see, so a short greeting is also a friendly greeting and it doesn't tax your tone of voice. And so that's why we want to make it friendly. Something else you want to do to make it friendly is use your name last. If you use your name last, people will remember your name. It's not comfortable for people to talk to somebody or share a lot of information with somebody when they really don't know who they're talking to. Even if they like to say, even if you like to say, "How can I help you?" just switch that. Say, "Thanks for calling Dr. Jones' office. How can I help you? This is Larry." What I can promise you is that if you use your name last, they will remember your name and they'll use it during the conversation. And they're going to feel more comfortable with you and they're going to think you're a lot more friendly when you do it that way. You see, if you answer the phone and say, "This is Larry, how could I help you?" what people are going to remember is, "Who are you? You're you, geez, you, who are you?" So I'm just asking you to make a simple switch. If you like to say, "How can I help you?" but "Thanks for calling the doctor's office. How could I help you? This is Larry." Along with your greeting, you want to be able to get the caller's name. You want to get that very, very early within the conversation. I like to ask patients, "Hey, once again, I'm Larry. Please tell me your name." That way, now they've gotten your name again and you've gotten their name. You want to be able to write that down because you want to be able to use it during the call. It makes the whole call more personable for the patient when you can do that. Also, when you convey that you're glad that they called, you're creating a connection because you do want to be able to begin to start to develop rapport. Now, I'm talking about rapport on a professional level. This happens very, very quickly when you meet people personally, and it happens even faster when you do it on the phone. Part of the way that you can develop rapport with a patient is by asking them questions. And so I find that personal connections are the best. And I would start by asking them, "Hey, who could we thank for telling you about us?" And it's likely that they'll say that they got your name from Miss Smith or, "I got your name off the internet." That way you can comment, oh, you saw us on the internet? That's great that you found us that way. A lot of our patients find us like that, so we're glad that you noticed and you gave us a call. When you acknowledge the referral source, what it does is it reassures the patient that they made the right decision in calling you. And it provides them with the kind of encouragement that they need to answer your questions and to be curious about who you are and what you're going to be doing. So there's that very, very specific rapport that you want to be developing. The second step that I want you to follow is that you want to find out, why did this patient really call? And what I want to warn everybody against is that you don't want to assume it's what they say. We have to remember, patients don't know what to ask us. We shouldn't even be expecting that they would. Matter of fact, in the calls that I've audited over the years, most of the questions that they ask are not even asked in any logical order and don't even make any sense. See, they call and they say, are you open on Sunday? Do you see children? Do you do whitening? Do you waive copays? I mean, the questions are all over the board. They don't make any sense. And it's right where we get ourselves into a lot of trouble. So what I'm saying to you is, don't assume what they're asking you is what they want. You have to be careful. And so this takes practice. That's why I'm saying that you've got to have preparation in all of this. You have to resist the urge to answer those questions. Now, you might be thinking to yourself, well, wait a minute, Larry. These people called to ask me some questions, and I'm good at giving answers. I've got to give them an answer. Well, you're right, you do, except you don't need to do it right now. Remember, I'm of the assumption that the patient doesn't really know what to ask. And so this is where we lose the conversation, because when they're asking questions, when they're doing that, what's happening is they control the conversation. And what I mean by controlling the conversation, really for you, is that they control the language. They also control the content and what's delivered, because they're asking, you know what I mean? Do you waive copay? Are you open on Sundays? Do you have a hygiene department? Can I get a Saturday appointment? And you're trying to be real nice, and you're thinking, yes, yes, no, 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 yes, yes, I think so. Well, they go, okay, well, thanks. You sound nice, and they hang up the phone. And then we're left on the other end of the line wondering, well, geez, you would have liked us if you would have given me the chance. And I want you to hold that thought. I want you to hold that thought. Geez, you would have liked us if you would have given me the chance. Because I want you to remember that people, patients calling on the phone, don't give us that opportunity. We have to take that opportunity from the patient. Now, it doesn't mean that you're rude about it. You don't say like, hey, be quiet here. I've got to ask the questions. That's not what I'm saying. You have to resist the urge because you want to control the conversation by asking your own questions. And what you'll discover is that the questions that you ask actually will take the patient where they want to go and didn't know how to ask you for. So it completely changes the tone of the conversation. You see, it starts to sound something like this. Hey, thanks for calling. It seems like you've never been to our office before. You see, you can convey to them, welcome to our office. We're glad that you called. Who can we thank? That gets them to start talking. They'll say, oh, well, no, I haven't been to your office before. I was just looking for a dentist. Well, welcome to our office. We're really glad that you called. I'm wondering if there's anyone that we can thank. Well, I saw your name on the internet. Gosh, that's just fantastic. Now, I'm going through this very, very quickly, but what I want you to see is you're letting the patient talk. It's helping them feel more relaxed with you, and they're going to start to learn that, hey, I'm going to get my needs met by doing this. We also know that the questions they ask are not in any logical order. So this isn't a very coherent conversation when you let them ask the question. You can professionally transition the call from the patient. And so you can convey to them, I want to make sure that I do this correctly so that you'll get the right appointment and proper amount of time. Tell me more about, and then you might want to discover the reason for their call, or if they have any particular things that need to be addressed right away. You see, I'm going to give you a best practices alert here. You'll see a few of these as we're coming along, because I've noticed in the people who are most successful in converting these phone calls is that they have a very specific outline that they follow. And I know why they do it. Either they did it by giving it some thought or maybe through trial and error. But I know they got to that point because having an outline that you follow provides consistency. It follows a logical order. And what I mean by that is it makes sense. You want to create a conversation that makes sense to the patient. And so that way the patient can remember the details. It gives them all the reasons why they should be calling you. So if you're starting to develop an outline the way that I'd like you to, the first step in your outline, regardless of what the patient says or what they ask for, you have to say to them, thanks for calling. Convey welcome to them. I'm really glad that you're here. And I'm wondering, who can we thank for telling you about us? Because you're now asking questions and you're also developing rapport with the patient at the same time. You see, the people who are most successful in converting these calls, they start to develop a rapport. And one of the ways to be able to do this is by getting them to make that personal connection with you. So it's very important that you do that. The third thing is, let me get a little bit more information. And so I want to do this correctly and make sure that I schedule the proper amount of time or give you the right appointment. So I'd like to gather a little bit more information. And that's where you start to ask questions about if they're having any particular concerns at this time. I'll keep adding these alerts as we go along so that you can develop an outline for yourself. The third step in creating your customer service personality is conveying to the patient, I understand what you need. So if I just slip back to the outline where you had just asked, let me get a little bit more information. Are you having any particular concerns at this time? This is probably where you also want to make sure you get their name and a callback number just in case you get cut off. Like I said, if you want to find out from the patient, are you having any particular concerns? Is there anything that I need to share with the doctor or, that we need to prepare for before you get here? You want to let the patient talk because you want to be able to understand what the patient needs. And you want to be able to convey to them, you see, what they sense is that you understand what they're looking for and you understand their problem. So for instance, if the patient says, well, I have this tooth and it's been bothering me for some time and I don't feel like I have an emergency, but I feel like the doctor ought to take a look at it. It's not going away. Well, you see, then you can mention to the patient, based on what you've told me, the best thing for you would be to meet with our doctor or have your teeth cleaned or whatever it is that you think the patient is, whatever you think they need. When you're able to phrase it this way, based on what you've told me, what the patient senses is that you have made a decision with my input. And because you know as well as I do, you're dealing with a very, very stubborn demographic of people who think they know more than you do. And so it's really important that they feel like they've had some input into any decision that you've made. Now, you can clarify this with them. Tell me if I got this right. This tooth has been bothering you. It's been quite some time. You haven't been able to get any relief from it. You've taken a Tylenol, and that seems to help for a short period of time. And the patient says, yes, that's what's going on. So I feel like I need to see the doctor. Well, based on what you've told me, the best thing for you would be this. And it's very important that you convey to the patient that you understand what is going on for them. The fourth step now is to actually for you to get excited. And this is where your tone of voice is really important here. And I'm not talking about excited like this is really going to be great and you're coming to us and we can't wait to see you and all that. Oh, this will be so much fun. No. That is not what I'm talking about. You want to be able to keep this very professional. I'm talking about expressing your excitement by promoting the practice and the doctor. So this is another best practices alert here. Matter of fact, I find that the office that are best at converting these calls, they know what the practice does well. So what I ask you to do is, if you're taking notes, is make an action plan for yourself and make a note for yourself to say, hey, what is the things that we do really well here? I mean, is it implants, veneers, treating hygiene patients, gum therapy, dentures, sleep dentistry? I mean, there's a wide variety of things, but I would say to yourself, do I have a list of the things that we do really, really well in our office? Because when you know what you do really well, it makes it really easy for you to promote it with your patients by saying things like, gosh, we do that really well, or our doctors had a lot of training in that area, so I know we're going to be able to help you. So as a best practices alert, get a list of the things that you do really, really well. Now, I won't be surprised if that list you have is very, very long, and I don't think you'd be surprised either. So along with getting excited and showing your excitement in promoting your practice, complement the practice. I would recommend that you use phrases like, you've called the right place, or geez, you're going to love our doctor. Patients tell us that they really like things like that. The doctor does a great job with veneers or implants. I hope you're not shocked that these are not complicated phrases and they're not tricky things to say. You can take the spirit of what I'm saying to convey here, or what I'm trying to convey here, and choose your own words. But it doesn't have to be complicated. People do not complicate on a really, really high level. In our culture, we don't use really big words, and we don't use long sentences. We say things very, very short. Think like a text. It works for a lot of people. Compliment the office. Let them know that you're glad that they called. You're going to love the doctor. We spend lots of time studying these things, so I feel like we're going to be able to help you. Again, when you do this, when you compliment the office, not only are you promoting them, you're offering them reassurance and you're offering them encouragement that they've made the right decision. You see, I'm a firm believer that if you can't provide the patient with everything that they want, because maybe they're looking for a Saturday appointment and you're not open on Saturday, or maybe they want an appointment in the evening and you're not open in the evening. You see, if they like what they hear, if what you had to say to them made sense, there's a high probability, because I see it all the time, that they'll put those things on the side. And possibly they'll say, well, you know what? I really was looking for something on Saturday, but I never called an office where people sounded so positive about where they work. And I'm a little bit afraid to go to the dentist. So I want to be around people like you who want to be at work. My point here is that you conveyed that through your tone of voice, and that the way that you you conveyed all that you wanted to be at work through your tone of voice and the way that you complimented the office. So if you can be positive that way, there's a really good chance that they'll put other things on the side. And we need that, because we know we can't be all things or offer all the flexibility that many, many patients want today. Now, the fifth step is, and I hope you noticed, is to save all those boring details until the end. If somebody says they'd like an appointment, you certainly don't want to start out with, well, we'll get you in for an exam and x-ray, because I can't think of anything that would make anybody yawn faster than that. I also want you to remember that when you jump to, well, we'll get you an exam and x-ray, you offered an opinion, or you offered them a solution before they've given you any input. You've made a decision without their input. And when you do that, it's likely that they're going to start to resist. And then they're going to want to, they're going to start to resist you because you didn't allow them to provide any input. People think they know more than you do today. Patients are suspicious, they're cynical, they're distrustful. So as soon as you come to some conclusion about what they need before they've had a chance to let you know, we are going to get into trouble. The details are boring too. So let's just put those in the end. All that name, rank, serial number stuff, you can do that later. Let's get the appointment first, because our main objective when we pick up the phone is to make sure that the person who's calling schedules an appointment with us. That's what we want to do. So we want to get them excited, or at least curious about having them meet you. Another best practices alert is that you never want to be guided by a computer screen. You see, computer forms are too rigid, and they force you to follow a set of order that you have to follow. I want you to have some flexibility. So details only make sense to a patient after they've decided to make an appointment. So in developing your specific outline, the fourth step in your outline would be that you want to prepare the patient for the appointment. You see, now that you found out what it is that's going on with them, you've made a decision about what would be best for them, that they should come in and have the doctor take a look at this, or perhaps have a comprehensive oral evaluation. Mrs. Jones, let me explain to you what will happen when you get here. And this is very, very important part of creating curiosity with the patient. It's letting them know what you'll do. And I will say that today, this is not common. Today, what is very common is when a person calls for an appointment, you just try to get them in as quickly as possible. Patients who are going to go outside of their insurance, patients who are going to pay you more, patients who are looking for comprehensive care, I want you to believe me on this. They want to know, who are you and what are you about? And so in this fourth step, what you're doing here is you're preparing the patient for the appointment. What you're doing is you're creating curiosity. So I'm going to go out on a limb here. Because I'll bet a lot of you who are listening come from practices that deliver comprehensive care. And that tells me you do things differently in your office than most other dentists will do. And we know when things are different, people get more suspicious. And if you're a patient who's already a little bit cynical and suspicious as it is, so you want to let people know, it sounds like you need an exam from the doctor. He's very, very thorough. We're going to reserve a full 90 minutes or an hour, whatever it is, whatever it takes to be in your office. But during this time, the doctor is going to do these things. So if you don't have a list of what the doctor does during the exam, I want you to put that on your action plan to find out what goes on during a new patient examination. Because if you can stop and tell the patient, you're going to be here for an hour, and during that time, we're going to take your blood pressure, we're going to review the medications that you're on to see if they aren't complicating things in your mouth, we're going to check for oral cancer, we're going to look for gum disease, we're going to evaluate the condition of any dentistry that's already in your mouth. You see, we look for these things because if we see something going on in your mouth that we know is going to cause a problem for you sometime down the road, well, the doctor is going to want to talk to you about it. This way, you can let us know what you'd like to do. So you can find out from the patient how that works for them and inquire if they have any other questions about this visit. Okay. And so I find in offices that take the time to explain what happens during the appointment, it creates curiosity for them about who you are and what it'll be like to visit you. So you want to provide this information to them, just simple bullet points. You're going to be here for an hour. We're going to take your blood pressure. We're going to check for oral cancer. We're going to examine you for gum disease, look at the condition of your teeth. You see, just quick bullet points, because people do start to get curious. I wonder if I have a problem with oral cancer. I wonder what my blood pressure is like. When a patient gets curious, a patient starts to commit. And that's what we have to remember. So you can ask them things like, how does that sound? What do you think? Patients respect decisions that are made with their input. And so that's why it's very, very important that you want to get feedback from them. So you ask them, what do you think? What other questions about our office can I answer for me? Tell me if you agree or disagree. You see, I'm not afraid of their answer because I know if patients like what they hear, they're going to go along with it. And in the event that they do have some questions, well, now we can talk about it. You see, you've made it very, very safe for them to provide their input because you asked them. So I want you to see that this part about describing the exam, it's very, very important in converting patients, and it's making them feel like they have control over what is going on. So what do you say now when you get a new patient on the phone? Let's say somebody calls, and this one is a little bit easy, but if it's a brand new patient, Obviously, I would start with, welcome to our office. We really enjoy working with new patients, so I'm glad that you called. Matter of fact, is there anybody that we can thank for telling you about us? And notice I'm always asking, is there anybody that we can thank for telling you about our office, as opposed to, how did you hear about us? Because I think that when you ask somebody, how did you hear about us, it makes them feel as if though they needed to have that special code, or maybe they needed to know somebody to get in. And that's not true. We're just curious because we want to be able to thank that person. So we say, who could we thank for telling you about us? And when they say something, you want to acknowledge it. Well, you know what? I want to make sure that we get the right appointment for you, and we do this by the book. So let me get a little bit more information. So that's where you want to be able to get their name and a callback number and any other info about their concerns. And then you would say, based on what you've told me, the best thing would be, and then explain what you think they should do, whether it's a comprehensive oral evaluation, maybe come in to see the hygienist, or maybe it's an emergency visit. You ought to get here today, but you want to make your decision about what they need, prepare the patient for what will happen, and then ask them if they have any additional question. Now, I know another good practices alert here is that you want to be able to show empathy for the patient. And what I mean by empathy is that you reflect their feelings. If they say something to you like, I do have this tooth that's bothering me, and it's been quite some time, I think a doctor needs to take a look at it, although I don't have time to come in today, I can schedule an appointment. I would express to that individual, gosh, I'm sorry to hear that you've been uncomfortable. You see, just you reflecting back to them what they have said further tells them that you understand me. And when you understand what's going on and the issues that I have, it's very important to me that you understand that. So you reflect their feelings. This is very, very important. Matter of fact, what I would say to everybody who's listening, who answers the phone, anytime somebody calls with any type of particular concern, or particularly if there's pain, you would always respond with empathy. And that empathy should be, gosh, I'm disappointed to learn, that you're not feeling well, or that you're having some discomfort. If they don't express any particular concern or pain, then you would always follow up with rapport. And rapport would always be, I'm really glad that you called. Is there anybody that we can thank for telling you about our office? So that you would go that route. So that's just a little tip there to help you know when you should use empathy and when you should use rapport. But it's very important that you understand the difference. So let's say, for instance, this is a new insurance kind of patient. Now, I know that there's those calls out there, where the patient kind of calls and says, do you take XYZ kind of insurance? And I just want you to hear that if you answer that question, if you go into answering that question right away and you say, well, no, we don't participate and we're considered out of network, so you'll have to pay us when you get here. I mean, it was even hard for me to say that and not change my tone of voice because it's so negative. And of course, when it's negative, the patient who doesn't know you is going to say, oh, okay, well, thanks. I was looking for somebody who took my insurance, so I'll just keep calling everybody else who's on the list. And bye. And then they hang up. Now, we can't afford to have that happen. Now, I know some of you do participate with a lot of insurance, but you may not participate with every plan that's out there. And I want you to understand that it doesn't mean those patients can't come to your office. And so somebody says, I want to know if you take whatever kind of insurance. I'd let them know that your insurance company works with us as a non-participating provider. And many of our patients who have the same type of plan come to our office. So we know there's an out-of-network benefit. They really like us. And I think you would too, Miss Jones. So it sounds like you haven't been here before. Now, I know how that patient is going to respond. They're going to say, well, no, I haven't been there before. I'm just looking for somebody who's on my plan. And so when they say that, I would say, well, baby, welcome. We're so glad that you called. And now you can go through the outline that you've just created. If I'm making any sense here, and I just made a very, very quick transition, but I very briefly answered their question, and then I asked them a question. Sounds like you haven't been here before. And they're going to say no, because I'm looking for somebody who's on my plan. Well, welcome to our practice. We're really glad that you called. We like working with new patients. Well, I know, but if you're not on this plan, I don't know that I can come there. Well, we know that you can come here because your insurance company works with us as a non-participating provider. We treat lots of other patients who have the same type of plan, so we know there's an out-of-network benefit. Yeah, but that sounds like it's going to cost me more. Well, you know, Miss Jones, you know those other patients with your plan who still come here, they do tell us it is a little bit more, but really not that much. And they feel like it's worth it. So I feel like if you give us a try, you'd like us too, just like they did. What I have found is that if you address it this way and you start by welcoming them and start asking your own questions, who can we thank? Let me get a little bit more information. Well, let's see if this would be the right place for you or not. We'll find out later when we get to some of those boring details, whether it's really going to work or not. What I don't want you to do is cut yourself off at the knees. You see, if I don't get a chance to talk to them about who we are and what we do, how do they know whether it's going to, how do they know whether they're really going to like us or not? I can promise you, if you get to a point where you can raise their curiosity level and talk about your exam, then they're going to realize, hey, you are different and I think I need you. So let's say this is a shopping patient that comes along. I hear tons of phone calls like that right now. Matter of fact, as the economy had gotten bad, more and more people are shopping because they want to know the cost of things. Lots of people have lost their insurance, and if they had insurance, it's not as good as it used to be. So we don't want that to mean that people can't come to us. So if you're a shopping patient, again, I'd show some empathy. I'm sorry to learn that you'll need dental treatment. What makes you think you'd need, if they ask like, well, how much is an implant? I wouldn't start with, well, here, implants are $10,000, because they're going to say, well, that's more than I wanted to spend. Matter of fact, any number you say is probably going to be more than they wanted to spend. So when they say, how much is a veneer, or how much is a crown or a filling or whatever, I would say, gosh, I'm sorry to learn that you need dental treatment. What makes you think you need that, or whatever it was? See, they'll explain that they've either been to another dentist or somebody had told them that they needed the treatment. I don't think that there's anything wrong with quoting a fee, with one exception. I think you would only fight with a patient if you try to tell them, well, I really can't tell you how much it is. There's so many variables. You see, patients don't understand what all those variables are. They don't know what those things are. So they'll think you're trying to pull something over on them. I don't see anything wrong with quoting a fee. I think so long as you do it with a follow-up. And so how that follow-up sounds is like this. We're really happy to be able to provide our patients with many choices when it comes to crowns. So that means that the fee can vary quite a bit. Matter of fact, it could run between this and that amount. I would quote them a range, depending on what you choose. But Miss Jones, how does that sound? And I would always quote a fee by asking that follow-up question. When you ask that follow-up question, I know what they're going to say. They're going to say, boy, that sounds like it's really expensive. But you see, what I want you to recognize is that you've engaged them in a conversation that gives you the opportunity to talk to the patient about how, yes, it is expensive. And let me tell you why you're going to love it. You know what I mean? If you're calling around, our fee probably does sound higher than what you may be finding in town. But we have a lot of patients who come to our practice from other offices, saying that they were disappointed in the care that they had gotten. And you know what? When we looked in their mouth and saw the quality of the materials that were used, well, we knew the doctor did the best he could with what he had to work with. So we're real happy to give our patients the quality that they're looking for. My point to all of you is, I think it's okay to quote a fee. I don't think it scares anybody away if you have that follow-up question. Miss Jones, how does that sound? Because they'll tell you either it sounds okay or it doesn't. Now, more often than not, they're going to say, geez, that sounds really high compared to the other doctors that I've called. But then you're in a conversation with them now, and that's what you want. You're going to be better. You're going to be better than what somebody else might be doing. So you want to be able to talk to the patient about that. I also like it when you do things in the way that I'm describing, because what I noticed with these best practices is that we're able to treat everybody the same. We don't have to treat anybody different. We don't have to act like, oh, you're just a shopper or you don't care about comprehensive treatment, because when we start developing that type of attitude, when we start to have to judge, where is this patient? Do they have a high IQ or a low IQ, or are they above the line or below the line, or anything like that? What I want you to recognize is that when we develop that attitude, it develops in our tone of voice. That's when we start to sound impatient or as if we couldn't be bothered. We don't want to develop a reputation like that. I want to give everybody the same opportunity to get to know us and decide for themselves. Now, I'm not a gambler, but I have gambled often in this issue. And I can tell you with all my years of experience, I'm very comfortable with what I see patients deciding for themselves. Because when they like what they hear and they like the way you say it, there's a really, really good chance that they're going to choose you. So everybody gets treated exactly the same, and it doesn't have to be complicated. The next thing that happens is many of you, because the internet is just so prevalent today, and of course, if you are a dental revenue client, you know that you get leads, through the internet, through your website. I know that many of you probably get email questions and things like that. And so I want to take just a second here to close to talk about how to follow up on a lead, because I want all of you to understand that you shouldn't feel desperate because you're following up. Patients actually expect you to do this, believe it or not. And so what I'm going to recommend is, if you get a lead through your website or an email lead or whatever, somebody requesting an appointment, then I would suggest that you start with calling that patient back. Give them a phone call. And you can say something like, hi, Susan, I'm just following up to schedule or answer that question from your email. Start with a phone call, and you can leave them that message if you're not able to get in touch with them. If you're not able to get in touch with them, I would continue, and yes, I put it in red for a reason, that you should continue to follow up with these individuals with 3 to 4 email messages. Again, many times people are being very impulsive when they send a request for information. Sometimes they do it in the middle of the night. Sometimes they might have even forgotten that they had done it all together because they're looking at a lot of other things. So I want you to see how the repetition helps with the patient. And if they're getting good information from you, they may decide, well, nobody else has followed up with me, or I've never gotten this kind of good information from the other offices that I left messages with. I'm going to call these people back. So what I would recommend is, in the 3 or 4 email messages that you use to follow up, number one, if they called about information about your practice or information about a procedure, then you can send that information in an email to them. I wouldn't just send them a link, well, here's our website, go read this, because they've already been to your website. So you want to make this a little bit more personal. You could also send them perhaps an article or a recent blog post that you feel might be interesting to them. You could send them either a picture of maybe a crown or a veneer, again, whatever they're asking for. Here, I do think it would be appropriate to say, if you'd like to look at more pictures of crowns or bridges or whatever, here's a link to our Smile Gallery. So, you could do that. And then as a final email, as you're touching base with them, you might send them a couple of reviews or maybe some testimonials that patients have given you. Again, I don't want you to think that it makes you sound desperate, because you're not, because people don't have to read these, or they could email back, say, leave me alone. I'm tired of hearing from you. But then we know what their answer is. As far as the final attempt, I would make one last phone call actually to the patient. So you start with a phone call, and then 3 to 4 email messages, and then a final phone call. You should plan to attempt to try to get a follow-up on a lead really 6 times. But let them know, say, hey, I followed up a few times regarding your request, and since I haven't heard back, I'm going to assume that you're not interested in moving forward. If something changes and you'd like to reconnect, please feel free to call or email me. Otherwise, I'll assume we're done for now. I wish you all the best. So it's just a real friendly, either I would make it a phone call for this very last time, but it's very friendly. Practice for your tone of voice so you don't sound like a smart aleck, and then let it go. I learned from managing recall departments, hygiene recall departments, that many times we sent cards, we sent texts, we didn't get any answer. We called them again, no response. When we finally sent the patient that last reactivation letter asking them if they wanted to remain active in the practice, that's when we finally got a phone call. And we finally got that phone call because they felt like, yes, I want to be active. And we're like, well, good. If you want to be active, then you need to schedule an appointment, and that way we'll consider you active. So I have found that if you make this one final attempt, many times that is what pushes them over the line to actually give you a call. Another thing that we're practicing, we're just kind of working on it, but we don't see any reason why it wouldn't work for you, is that particularly if you're working with dental revenue, then you know that when they send a request, or when a patient sends in a request, that email response comes to your email inbox. And so what we're working on, you would do this privately in your own office, is have that email go to a special inbox or to a special email address that's only for these types of email messages. It's an email address that's not used for anything else. And the reason for that is because then you can turn on your vacation responder to, let's say this person sends you an email in the middle of the night, and a lot of times they do that, or they'll do it maybe 7 or 8 o'clock at night, and you're not going to be able to respond to them until you get back in the morning. And so what we're doing is they put in their request, dental revenue sends the email to us, and then when they send the email to us, we have the vacation responder is already with that inbox, and the patient automatically gets a response from us. Hey, thanks for your inquiry, and we'll be following up with you in the very next business day. So they do get some kind of response from us right away. Now, this doesn't count as one of your 6, but they do get a response from us right away, so that they at least know that we got your message. So those are the things that I wanted to share with you today. And what I'm going to end with is I thought I'd put a picture of myself up here because I don't know if my voice and my physical picture matches up with what you thought I'd look like. But if it doesn't, and you think I look better than I sound, or maybe I sound better than I look, then you know the power of the tone of voice. So I really want to thank everybody for this time today. It's a really important topic, and I'm here if there's anybody who has any follow-up questions.
Hey, Larry, thank you so much. This is Bill again. Guys, I'm going to start the question and answer portion of this presentation. I think the best way to do this is, if you have a question for Larry, just type it in the chat and message me directly, or you can message the entire audience. But I'm going to ask a couple questions that I had already been asked by a few of you, and then as we get more questions, we'll introduce those to Larry as well. Larry, the first question that I had was, this person feels like they do have a problem and their staff needs improvement, but what is the best, or where is the best place to start when you feel like you have a problem?
Are they saying like they feel like they have a problem in converting calls, or do you think that's what it is?
Yeah, I think in context of answering the calls, that they don't feel like they're doing a good job converting the calls. If they feel like they do have a problem, where do they start?
The common trap that I find is that people don't resist the urge to answer other people's questions. And so a patient will call and say, "Are you taking new patients?" And you might laugh if you're listening to this, but I hear it all the time. A patient calls and says, "Are you taking new patients?" And the office says, "Yes." And then there's like this pause. And what happens there is the patient fills the void. Well, do you treat dogs? Do you have a nice hygienist? Did your doctor have a degree? Has he ever been arrested? Because we have to remember the patient doesn't expect to have to know what questions to ask us. They expect us to do that. So while you're developing an outline, where I'd start with is number one, are you greeting people? Hey, thanks for giving us a call. Like they say, are you taking new patients? Yes, we are. Thanks for giving us a call. Matter of fact, start right there. Is there anybody that we can thank? So not knowing specifically what this person is referring to, I know the most common trap is that pause right there. Get in the habit of asking your own questions.
Actually, this question kind of goes in line with a follow-up to that. What's the best way when they're trying to evaluate their staff? What are the best areas to evaluate them when it comes to discovering whether they're good at converting these calls or not?
Well, number one would be like the number of calls that they get, but you can set up a simple grading for you. At the All-Star Dental Academy, we have the great call process. And so if you can write down the acronym GREAT, and what it stands for is greeting, rapport, engage, ask for the appointment, and then take the notes. And if you look at the outline that I just gave you, it follows that process. Are we greeting the patient? Are we developing rapport by, we feel like the easiest way is to ask the patient, who can we thank? And then engage them by getting a little bit more information or finding out, what their concern is. And then talking about the appointment and then taking the notes. And so give yourself a point for each one of those. And so that's a good way to kind of evaluate how well you're doing.
I had one person message me and ask what's the best way to contact you about working with his staff.
Oh, you can get a hold of me at larrymguzzardo.com. And I'd be happy to personally talk to you about, what we could do.
All right, guys. Any other questions before we complete the webinar? All right. Well, I'd like to thank Larry for his time today. It was extremely insightful, and we'd like to thank everybody that jumped on this call. We certainly appreciate the opportunity to work with you, and we all here at Dental Revenue hope that this was very beneficial to your ability to get the most out of our program. So if you have any other questions about this webinar or any parts of our program, please contact me at any time. Thank you so much, and enjoy the rest of your night.
Thank you all very much.